Help us look back on these last 12 months. We're now joined by the National Chairperson of the South African Medical Association, Dr. Angelique Coetzee. Dr. Coetzee, good to have you as always right here on the program. I mean, what are some of the lessons that you think we can reflect on as a country from this past year?
Sure. Good morning, and a good morning to all your viewers. Can't believe it's a year later. It feels as if I have lived 1,000 lives in just 12 months. So where do we start? Looking at, reflected on what happened. So let's start at lockdown level 5. That saw some regulations that didn't make any sense, especially from a medical point of view. And looking also back on that period, it was a terrible period in our lives. The effects of that on our economy will still be seen for many years to come. Also, we saw how deeply embedded corruption is in our healthcare system. And that also raises the question, what is happening in other departments, and will we get out of this? So at least this is being exposed. You look at procurement policies and processes, etc. We have also experienced a lot of problems in that. And hopefully, lessons learned here will assist us going forward with NHI. Because if we don't take what we have seen now during COVID-19, during this past year, we are going to be in trouble with NHI.
And Doc, I mean, just from a health perspective, we've seen, our health system go through, a journey in this past year, from the field hospitals to the pressure to the healthcare system, besides COVID-19, amongst others being, alcohol-related trauma. I mean, just reflect with me what healthcare workers just had to go through leading up to now what we're seeing with the vaccine rollout.
Sure, yeah. I think the average healthcare worker out there is all of them, I myself included. I think we experienced a lot of emotional turmoil, the emotional impact of what happened, everyone trying to do their best on the healthcare system with not enough infrastructure and not enough resources. We saw what happened on the PPE front. We saw what happened with lack of oxygen in some of these, especially the public sector hospitals, where you as a healthcare provider, especially doctors, needs to make certain decisions that is going to decide who's going to live and who's not going to live. That is actually something that no one should be exposed to. So that, again, the emotional impact of this will lead definitely to PTSD going forward, and a lot of major depression. You need to understand that people doesn't need to get depressed. But if there are circumstances that allows you to work under severe constraints and emotional circumstances,
right,
in the end it will trigger depression, which you actually would never had if it wasn't for your circumstances. Also important to understand that we are not trained for a pandemic. And I think this is a lack in the curriculum. And we need to address that. As I, from my side, I think this is not going to be the last of a pandemic that we are seeing. We need to train our healthcare workers much better on how to handle crises. And then look at our infrastructure. We cannot go forward without addressing this.
Absolutely. And I think you make quite an important point there, Doc, in terms of just training and better being prepared even for future pandemics. But due to time, I want to ask you also about this expected potential third wave. Are we better prepared? I mean, given the reflection we've just had, given the lessons you've just shared in terms of, what we've been through and how you suggest to make it better, are we better prepared for a third wave?
I haven't seen really a big impact in preparing. We still have a lot of HR problems. We saw the recent announcement that posts in the public sector will be cut. The problem is you can cut it, but not in healthcare system. First, get your HR component on par with what the need is of that specific hospital or province. Only then, after you have done that, you can start to look where can you cut. But just to cut, it's not going to work. It means we don't learn. We just go from one crisis to another crisis, and we have to. And I must say, National Department of Health is really, really trying their best. What we have seen during this pandemic is that National Department of Health is giving a policy of giving direction, and then most of the provinces is following their own direction and their own policies. There's not a proper working relationship. They all sit in meetings. That's not to be disputed. But when it comes to the implementation at ground level, it's two different worlds.
That is a call for concern, and hopefully will be rectified, Doc. But thank you for highlighting these issues, Dr. Angelique Coetzee from the South African Medical Association.